और बच्चों को म्यूट कर दो या अनम्यूट कर दो?
ये तो लगता ही नहीं है कि वो आप सुन रहे हैं, तो उन्होंने चुप करके बोलना नहीं होता।
या उनको सब आता है
नहीं, कुछ भी नहीं। वो ऐसा जैसे जब हम यहाँ क्लास लेते हैं तो उसमें भी अगली एक तो रोज होती है जो और से सुनती हैं, और वो लोग कहते हैं ना अनम्यूट इसलिए करना चाहिए कि पीछे से बातें आती हैं, बातें क्या करनी उन्होंने, बेचारे बस सुन रहे होते हैं। अच्छे बच्चे हैं, कोई ऐसी वो नहीं है। Bismillahirrahmanirrahim. This is the last lecture which is included in immunology. In fact, this amyloid material and amyloidosis. Amyloidosis is a condition or a disease in which there is a deposition of amyloid type of material. There is nothing, no relationship of this with the immune system or immunity. But still, we usually teach you the topic of amyloid or amyloidosis as a part of immunology. The only reason is that this material is made up of proteins. This has got nothing to do, it's not a part of the immune system, or it does not play any role in the immunity or the immune response. But amyloid material, as I told you, it's a pathological, it's not physiological. It's a pathological proteinaceous material which is made up of protein fibrils, and they are deposited in the extracellular tissues of different organs of the body. So extracellular tissues में deposition of amyloid है क्या amyloid? That is a pathological proteinaceous material. So that is deposited in different extracellular tissues of different organs, or maybe a single organ or many organs may be involved. And sometimes they're present under the skin, or maybe only, for example, in the tongue. So it's just a deposition of proteinaceous material. It should be considered a single, it should not be considered as a single disease. It's a group of diseases. So it's not one disease. It's a group of disorders or diseases. It should not be called a disorder, it should be a disease, a condition. So a group of diseases in which the amyloid material gets deposited. So it's the similarity of the material because of which those diseases, they are counted under one group. Material is the same. It's the physical nature and the chemical nature of amyloid material which is same. So you need to know the properties or chemical properties of amyloid material, because this is the only thing which is common in different diseases, and you call them amyloidosis of liver, amyloidosis of renal system, amyloidosis of and sometimes the name disease name is given a different name. For example, brain major, so we call Alzheimer is a disease in which one cause is the deposition of amyloid material in the brain leading to shrinkage. So brain में जब amyloid material या protein fibrils deposit करते हैं, so that leads to shrinkage, and Alzheimer disease is one cause of Alzheimer. One cause, Alzheimer's disease is disease, but one of the cause of Alzheimer disease is amyloid material deposited in the brain. So the common thing is amyloid material. What is that amyloid material? And amyloidosis means a condition in which there is deposition of amyloid material. Normally, the proteins have got there are numerous proteins present in the body. Intracellularly, extracellularly, rather the fibers, they are made up of proteins. So they are the building parts of the muscles and many other organs. So proteins तो बहुत सी होती हैं body में. Normally, uncountable number of proteins are there. And those proteins, obviously, they have got. Remember, the tendency is the chains of amino acids they make up protein. वो प्रोटीन्स जो हैं उनकी एक और नेचुरल क्वालिटी ये है कि देयर मे बी एन ओवर प्रोडक्शन ऑफ प्रोटीन सो लिमिट नहीं होती कई दफा देयर इज एन ओवर प्रोडक्शन एंड व्हेनेवर देयर इज एन ओवर प्रोडक्शन दे हैव गॉट अ टेंडेंसी ऑफ मिसफोल्डिंग तो वो फोल्डिंग ऑफ फाइब्रिल्स is a characteristics of long chain amino acid protein. तो ये जो proteins हैं initially in fact they are formed as they are made up of the mutation and of different proteins and covalent bonding or folding or misfolding, whatever the word, they have got the tendency to fold and they have got the tendency to misfold. So misfolding, yeah, folding or mutation and the other characteristics of जिसमें आप covalent bonding की वजह से भी इनमें they have got a tendency to form monomeric proteins. So they are called monomers. So it is due to mutation, due to folding, misfolding, or due to any reason of the natural characteristics of different proteins that monomers are formed. And aggregation of those monomers, when they are aggregated, they may be like bacteriology, they may be aggregated in groups or in straight chains. Whatever the condition is, this is called aggregation. The other name given to aggregated protein is oligomeric proteins. Oligo means two. So monomer is one and oligo means two or more than two monomers. When they get aggregated, they form oligomeric proteins. So ये oligomeric proteins, they can get they change into profibrils, or pro means before, fibril means fibers. So finally the fibers are produced. This is the one fiber. And those fibers, and they have got a tendency of folding. So folded proteins जो हैं, yeah, and these proteins are soluble proteins and toxic. They are subject to fragmentation as well. जैसे ये monomeric से aggregate बन के they become plastic. They get converted into profibrils and then fibrils, and those fibrils, they have got a tendency to fold and to make folding or misfolding or wrong folding. So you can call them these proteins. ये अनम्यूट ही कर दो मेरा ख्याल है वो बाकी ना डिस्टर्ब हो ग्लास उससे फिर
देना खोल के
मतलब ये मामा कि वो यहाँ नहीं आ रहा मुझे
क्यों
बात
क्लास
करनी
और
है
बता
मैं लाहौर आ जा
छोटे बच्चे को
उसकी मामा के बिजनेस
So excuse me. So we are talking that these are the characteristics which are common and these things they give the name amyloidosis. The chemical nature I talked, how do they are formed, and then the staining characteristics because of which again. So it is the similarities of this material which has given the name amyloidosis. I am again repeating, it has got nothing to do with immune system, but as they are produced by the plasma cells, which produce immunoglobulin. So immunoglobulin is one type of protein. When you say protein, they're made up of amino acids, and albumin is one type of protein, and globulins are the other type. There are many globulins. For example, those which carry the transferrin is a globulin, and there are many other proteins, thyroxine binding protein which binds to thyroid hormone, cortisol binding protein which binds. So proteins, they They play the role of a logistic role of transportation of one thing to the other place also. तो प्रोटीन्स तो बहुत होती हैं उनमें अब आगे फिर उनकी इलेक्ट्रोफोरेसिस व्हेन दे आर electrophoresed or they're placed in electrophoretic tank you can separate them into alpha beta gamma 2 then uh, alpha beta and beta 2 and then gamma globulins so globulins bhi kai tarah ki they can occupy different it's only that the plasma cell they produce proteins so इसे amyloid और amyloidosis को एक अलग चैप्टर के तौर पे नहीं पढ़ाया जाता किसी और सिस्टम में प्लेस नहीं कर सकते as I told you it's not one disease it's just a deposition of a material which is similar and that similar material की वजह से उसे amyloidosis कहते हैं So I'm sorry, Aniba, you are raising your hand, and I have all the participants are on mute. So just listen to the lecture. So we are talking that it's the similarity of their nature, जिसकी वजह से इस disease को नाम दे दिया. अब because this disease does not involve one system. So आप किसी सिस्टम में भी इस डिजीज को प्लेस नहीं करते इट कैन इन्वॉल्व वन ऑर्गन और मेनी ऑर्गन मे बी डेपोजिशन अंडर द स्किन सो एमोलाइड मटेरियल की डिपोजिशन जहां भी होगी उसे एमोलाइडोसिस कहेंगे क्योंकि ये सिंगल ऑर्गन डिजीज नहीं है तो इसे किसी सिस्टम में भी प्लेस नहीं करते आमतौर पे इट्स नॉट इन हियर बट फॉर अंडरग्रेड्स दिस टॉपिक यूजुअली पढ़ाया जाता है as a part of immunology. So, agla characteristic which is common because of which you give this one disease is the staining reaction. So, एक तो है कि उसकी chemical nature, physical properties, electrophoretic properties, जहाँ पे वो occupy करती हैं जगह. Similarly, when you stain them, the specimen, if biopsy अगर आती है amyloidosis of any organ, for example, amyloidosis of renal tissue, heart. तो ये जब आपके पास biopsy आती है, you stain it with hematoxylin and eosine. तो hematoxylin और eosine staining से ये किस तरह का how does it look like? The amyloid deposits they look like light pinkish material which are smudgy, fluffy, soft. So ये softness or cheesy type of a material which is light pink on hematoxylin and eosine. And usually the amyloid deposits they are surrounded by different eosinophilic. This is I'm sorry, esophagus. और ये esophagus is gastric mucosa में जो this amyloid deposits are. ये slide जो है वहाँ से बनाई. When you stain it with a Congo red stain, ये तो hematoxylin eosine stain थी, but if you stain it with Congo red, you can see the color more and it's almost orange or orange pinkish color. You see it under the microscope. There is again, you can see such a material or soft material under the microscope. एक और चीज है कि when you see it under a polarized microscope and stain it with Congo red dye, इस staining में और ये आप under light microscope या ordinary microscope में नहीं देख सकते. You have to use a polarized microscope. Polarized means polarization. ये एक material से it produces different rays. So birefringence. तो इसकी जो fluorescence है वो it is birefringence. So it has got two types of two different colors rays. पर आमतौर पे ये apple green color is usually seen. So if you stain it with Congo red dye and see it under a polarizing microscope, there will two things you can find, and one is that the color is apple green, and the second is there is birefringence of amyloid material. So these are the characteristics on the basis of which you call amyloid material. So amyloid material जब भी जहाँ भी ये होगा तो इसकी it's the appearance, it's the chemistry, it is the electrophoresis, it is the staining reaction, उसे आप amyloid material कह देते हैं. और वो amyloid material wherever it is deposited, I have already told you, it may get deposited locally at certain places, or it may get deposited in one system, or it may involve many systems. So amyloidosis is only and only given, the name is given because of the material. But there are still, you can say that there are more than 20 types of proteins which are involved in amyloid deposition. तो but common जो है दो तीन वो हम बात कर लेते हैं उस पे. 20 different types of proteins. They make material like this amyloid, but more commonly are. For example, one is primary, the other is secondary. So दो तो ये नाम आप याद रखें. There are four names which you need to remember in amyloidosis. One is you easily remember, you can easily primary amyloidosis and secondary amyloidosis. एक और transthyretin, lectin, not transthyretin, TTR protein, और एक को हम protein which is deposited in old age. तो ये चार main चीजें हैं which you need to remember, and number one is the primary amyloidosis. Primary amyloidosis, the other synonyms or the other names are plasma cell dyscrasia. So यहाँ से नाम से indicate होता है. It is the abnormal, the plasma cells producing abnormal or misfolded proteins. So also another name is immunoblastic lymphomas. But primary amyloidosis is the first name. इस disease को multiple myeloma भी कह देते हैं. So it's a tumorous or a nodular type of presentation clinically, but etiologically it is the primary disorder of immunoglobulin production. And you know where immunoglobulins they are produced, and we had been talking about B cells, precursor B cells. They transform into B cells and B cells into plasma cells. The plasma cells have got the capability to produce different immunoglobulins. So etiology ये है कि as it is the primary disorder of immunoglobulin production, and immunoglobulin कहाँ से आती हैं? You need to remember that these the B cells and plasma cell, कहना चाहिए swollen B cell when you call them, when they are present in the bursa or at the place of origin की वजह से, but the B cells precursor को pre-B cells भी कह देते हैं. So B cells, pre-B cells, B cells and plasma cells, they produce immunoglobulin. So primarily it is the disorder of the plasma cell. That is the reason you call plasma cell dyscrasia. It's a primary amyloidosis. You call it primary because it is a genetically predisposed condition. Multiple myeloma भी इसी का नाम है. होता क्या है? What happens is etiologically there is overproduction of immunoglobulins, that is excessive production of immunoglobulins. और ये immunoglobulins जो हैं, they could be complete molecule of an immunoglobulin, or it may be light chain, IgG light chain, it may be lambda chain, gamma chain, so small chains, fragmented immunoglobulins. But heavy chains, जिसमें दो long chains और एक दो short chains होती हैं, और variable और constant terminals भी होते हैं. So whole immunoglobulin intact sometimes is found, but mostly it is the fragmented free light chains or lambda or gamma chains. Heavy chains अलहदा से बहुत कम होती हैं. I told you that it is the more commonly it is the fragmentation हो जाती है उन immunoglobulin की. Excessive production तो होती है, but they are also fragmented. और ये fragmentation usually lysosomes की वजह से होती है. बहरहाल यहाँ लिखा partial degradation of these chains by lysosomes. ये जब fragmented immunoglobulins, when they circulate in the blood, they can get deposited in the kidney, or when they get deposited, as they are light molecules, fragmented molecules, so there is a tendency. Normally, there is no proteinuria. Remember, glucose or proteins, they are not passed in the urine normally. So if there is even traces of protein, one should be careful. Trace is a word which is given by the laboratory, that 1 plus protein, 2 plus, 3 plus, or 4 plus. Sometimes you just put a strip in the urine and see if there is protein or not. But even if there are traces of protein, one should be very, one should give, it should be taken care. तो ये जो immunoglobulins proteins भी चूंकि light molecular weights होती हैं, they can pass the glomeruli and they can, और ये किडनी से जब पास करती हैं उनका नाम, we call them Bence-Jones protein. And there is special methodology for the detection of Bence-Jones protein in the urine. तो Bence-Jones protein का होना किडनी urine में, that reflects that there is primary amyloidosis, that immunoglobulin, fragments of immunoglobulin, they are passing through the kidney filters into the urine, and they can be detected by the different chemical methods of laboratory. ये macrophages भी और endothelial cells and reticuloendothelial cells, they also have, you all know that engulfment is the characteristics of macrophages and reticuloendothelial cells. They engulf these fragmented proteins. So it is the glycosaminoglycan with the amyloid P component and degraded proteins, which gets deposited into different tissues, specific tissues. जहाँ पे आम तौर पे प्राइमरी एमाइलोइडोसिस में एमाइलॉइड मटेरियल डिपॉजिट होता है, एक तो ये जाहिर है जब when it is passing through the kidney, it can get deposited into the kidney. The other organs are heart, liver, gastrointestinal tract, and central nervous system. इसे इस प्राइमरी एमाइलोइडोसिस का शॉर्ट नेम जो है वो है AL type. Why do you call it AL type? L is the word from light chains. Because light chains are more commonly the component of this deposit. तो immunoglobulin की light chain के fragments चूंकि इसके component होते हैं, so the name given is AL type of amyloidosis or primary amyloidosis. Plasma cell dyscrasias, immunoblastic lymphomas, or multiple myelomas. So these are the different. Clinically, these are the myeloma cells, and these are the protein fibers. These are the myeloma cells. Don't get confused them with the true lymphocytes. You can see that there is a very small nucleus, but plenty of cytoplasm. Whereas in lymphocytes, if you see this slide, this is the lymphocyte. But these are the plasmas. So the lymphocyte को comparison करना है, और ये plasma cells. So plasma cells, जो myeloma cells for you. Myeloma, you call them plasma cell ही हैं, वो multiple myeloma is the name of the disease. So multiple is the word from, as you know, English word. Myeloma is they produce these protein fibers. अब ये amyloid material जो ये myeloma cells और ये वैसे दिखाए हैं for your the completion of your knowledge, but they can clinically get deposited in single tissue, single organ, or it can involve multiple organs. When it involves multiple organs, you call it systemic amyloidosis. We are still talking about primary amyloidosis or immunocytes dyscrasias, immunoblastic lymphomas, or multiple myelomas. चंद बातें जो याद रखने की हैं वो एक तो मैंने etiology बता दी, nomenclature बता दिया, और बता दिया कि ये it is the material which is deposited. That primary इसलिए कहते हैं कि it is usually related to immunoglobulin overproduction or fragmentation. So You can sometimes you can find that there are hemorrhagic petechial hemorrhages, or there could be purpura, or there could be this. जो clinical presentation है, जब आप इसे थोड़ा सा इसका लें और biopsy में देखेंगे, you will find that it's an amyloid material, and this is the very common site for the deposition of amyloid material, that is around the eyes, and you can see the upper lid and the lower lid and angle of the eye. So these amyloid material deposited in the extracellular tissues of lids around the eyes and in the angle of eyes. So ये is a very common site of deposition. Local हम बात कर रहे हैं. So clinical picture, it can get deposited local. होता क्या है, there could be hemorrhagic or purple or petechial hemorrhages, छोटे spots भी हो सकते हैं, जब वो मिलके बड़े भी spots आपको, और hemorrhage under the skin भी एक mix up with amyloid material. So purpura, petechial hemorrhages, and the site I have already told you. This is one local primary amyloidosis. Another is usual presentation. A very common presentation is the amyloid material gets deposited in the tongue. So जब tongue में deposit होगा, तो वो the tongue will become swollen and enlarged. That is called macroglossia. Glossitis is an inflammatory condition of the tongue. So glossia is the word this is from tongue. Macro means large. So there's a large tongue, and which usually जब इतनी बड़ी हो जाती है, you call it macroglossia, that कि वो मुंह से भी बाहर निकलती है. So there is protrusion of tongue from the mouth. Secondly, because the tongue जब macroglossic होती है, जब macroglossia of the tongue है, so what can happen is you can see these arrows. जब tongue बड़ी मोटी हो जाए, तो या it is macroglossia. तो और दांत जो है naturally it is protruding, as यहाँ पे आप देख सकते हैं कि जब इतनी भी बड़ी हो सकती है कि it can protrude out from the mouth. So obviously it can be bitten by the teeth जो आपके jaw के side पे है. This is called scalloping of the tongue. तो ये fissures जो हैं margins पे, tongue की margin पे दोनों side पे जो ये fissures बन सकते हैं, because the tongue is macroglossia and it is bitten by the teeth of the upper and lower jaw. यहाँ पे you can see that ये face के बहुत सी मुख्तलिफ जगहों पे this amyloid material is deposited. So you can say locally face is a very common place, or face में around the eyes and tongue, they are the more important things. मैंने अभी कहा था कि the usual presentation is that there are either petechial hemorrhages or purpura. Sometimes another common site is the glottis, so vocal cords. उनमें भी, और एक और ये this picture is only shown to you because ये ताकि याद रहे कि it is not only the petechiae or hemorrhages or purpura, or sometimes they're so thick that they form a nodule. So nodular deposition भी कई दफा and looking like a tumor. And when you take the biopsy and see it under the microscope, you can easily differentiate it on H&E that this is an amyloid material, it's not a tumor. So nodular presentation may be there. So face is the important thing, place जहाँ पे amyloidosis local. When you talk about the systems, it can get deposited in the brain, in the heart, in this spleen, liver, the right side, pancreas, and kidney. So these are the common organs where the amyloid material gets deposited. और इसमें आप उनके जो फंक्शंस हैं ऑर्गन्स के जो डिस्टर्ब्ड होते हैं उसकी वजह से आप डिजीज को डायग्नोस कर सकते हैं बट there are certain common symptoms which are called general symptoms of the disease that the patient is lethargic, weak, tiredness और ये उसके आमतौर पे जो है weight loss sometimes you have a confusion that there is a chronic disease or chronic granulomatous disease or some type of malignancy है weight loss आमतौर पे ट्यूबरक्लोसिस में भी होता है chronic granulomatous disease है so chronic granulomatous diseases हो या malignancies में weight loss is a very common finding but tiredness weight loss weakness these are the general symptoms of amyloid material getting deposited in these और इसके अलावा जो है there is edema around the ankles and the legs so edema तो ये आप जब किडनी में अगर amyloidosis है there might be a differential diagnosis with nephrotic syndrome या आप nephritis या nephrotic conditions हैं जिनमें edema around the ankle होता है तो so you may have to think of differential diagnosis बाकी ब्रेन में जब ये होता है तो if you take an X-ray of the skull you can find that there are punched holes in the bone जैसे आप punch machine से अपने पेपर को punch करते हैं so there these are the holes you can see it the holes punched hole opacities in the skull is a supportive evidence of amyloidosis of brain और अगर Alzheimer disease है और उसके एक्सरेज में punched hole findings हैं तो you can think of amyloidosis of brain so you can call Alzheimer's disease because of amyloidosis or deposits of amyloid material in the brain or protein fibrils in the brain leading to shrinkage of the brain. Alzheimer is a very common disease you might be knowing it. तो heart में ये एक देखें myocardium में you can find this cheesy material deposited. So amyloid material can get deposited. So arrhythmias can happen. If there is a deposition of amyloid material in the heart, you can have arrhythmias. Renal failure, if it is deposited in the renal, so that is the reason I was telling you, you can get it confused with nephrotic syndrome as well. So when renal failure is there, you have to look towards the list of the causes of renal failure. So one cause of the renal failure is amyloidosis of liver, renal system. तो किडनी की एमाइलोइडोसिस में आपको जो डिफरेंशियल जो टीडी है वो वही होगी जो नेफ्रोटिक सिंड्रोम की टीडी होगी प्रोटीन भी आ रही है लेकिन इफ यू गो फॉर द यूरिनालिसिस यू विल फाइंड दैट देयर आर Bence-Jones प्रोटीन्स तो एरिथमियास और सो लिहाजा आप dyspnea shortness of breath if there is amyloid deposition in the lungs Alzheimer's or loss of memory if there is an amyloid deposition in the brain which is like Alzheimer's or other diseases of brain in which there is a loss of memory तो ये अब रीनल में होगा तो रीनल फेलियर से मिक्सअप हो सकता है लिवर में होगा तो लिवर की डिजीजेस से सो यू कैन तो जरूरी नहीं है because these organs are not accessible so biopsy cannot be taken so you have to depend on many other laboratory findings one of the laboratory finding is urinalysis में जैसे मैंने कहा Bence-Jones protein का होना is suggestive of amyloidosis of more commonly of kidney but amyloidosis of other organs उसमें भी चूंकि it is immunoglobulin fragments of immunoglobulin they are passing and it's from the circulation they are coming to the kidney तो kidney का amyloidosis होना जरूरी नहीं है if there are Bence-Jones more chances are that it is जाहिर है जहां से गुजर रही है वहां तो डिपॉजिट होगी so amyloidosis of kidney will be there but amyloidosis of other organ भी हो सकते हैं जिसमें आपको Bence-Jones protein आ सकती है so if there are nothing kidney की Bence-Jones protein मौजूद है but kidney की कोई और function disturbed नहीं है we'll talk about kidney function fourth year creatinine urea या और functions जो भी है assess किए जा सकते हैं जिससे kidney की functioning को तो आप but you can think of amyloidosis as इसके अलावा amyloidosis मैंने कहा it is sometimes single organ sometimes multiple organ If there is amyloidosis of kidney, you have to think of that amyloid material may be deposited somewhere else. So बाकी जगहों पे भी हो सकता है treatment तो आपकी इसकी जो है वो मेडिसिन वाले पढ़ाएंगे but कोई अच्छी treatment नहीं है. बहरहाल another diagnostic help can be taken by electrophoresis. Normally electrophoresis में this is albumin, this is alpha 1, alpha 2, beta और beta 2 भी होता है. Beta 2 macroglobulins are usually beta 2 occupy करते हैं और उसके बाद ये this is gamma globulin. Gamma globulin की जो height है आमतौर पे इसकी 1/3 या 1/4 के करीब हाइट होती है बस यहाँ तक. But you can see how much gamma globulins are produced. So M band आप इसे कहते हैं कि you can find an M band on electrophoresis. So presence of M band, that is very high spike of gamma globulins, that is suggestive of amyloidosis. Rather, it's a very confirmatory almost, you can say. So this was about a L type of amyloid or light chain amyloid or immunoglobulin related amyloidosis or primary amyloidosis or multiple myeloma or plasma cell dyscrasia. So ये सारे नाम आप दे सकते हैं. The other type of material which gets deposited is AA type. AA fibrils, AA is इसे SAA भी कहते हैं sometimes. It's not only AA, it is SAA भी है, is the name. Here it is written. Serum amyloid associated protein. So amyloid तो उसके characteristics की वजह से कहते हैं. It is associated with serum proteins, and all of you know that serum में जब proteins होते हैं, so usually you say that reactive proteins, they are acute phase reactants in inflammation. Inflammation जब आपने पढ़ा होगा तो उसमें देखा होगा different types of proteins they are produced which you call acute phase reactants, or तो acute phase response is usually seen in serum associated amyloid deposition. So this SAA or AA type of amyloidosis or secondary amyloidosis, ये इसमें जो प्रोटीन है वो सर्कुलेट करती है, it's synthesized in the liver, it circulates, and it is usually associated with inflammatory condition, particularly chronic inflammation. So persistent inflammation, cancer or familial Mediterranean fever, these are the etiological factors और इनमें ये प्रोटीन होती हैं. What happens is activation of inflammatory cells releasing to different types of cytokines, and this is also named the name given serum associated acute phase reactant proteins. The secondary amyloidosis may remember here, they also circulate in the serum. तो इसे A type of amyloidosis भी कहते हैं, but remember there are only very few places where secondary amyloidosis is seen. It is characterized as it was primary amyloidosis by the extracellular tissue deposition of fibrils, and they are composed of fragmented amyloid material from the serum. और ये चूंकि inflammatory protein होती हैं, so you can say these are the tissue necrosis factor alpha, interleukin 6, interleukin 1, etc. So these are the inflammatory cytokines which are increased. It's not the immunoglobulins which are increased. In primary amyloidosis, it is the protein की type है immunoglobulin. लेकिन इसमें जो है it is the cytokines, interleukins, tissue necrosis factor. So inflammatory proteins की increase होने की वजह से you call it secondary, and they are secondary to some chronic inflammation or sometimes in particular. तो इसलिए इसे आप secondary amyloidosis या AA या SAA भी कहते हैं. These are the common places are that they are deposited in the joints, so the joints are inflamed and swollen, and inflammatory exudate is there, or liver is also one of the place जहाँ पे अभी मैंने पहले भी कहा था कि synthesized in the liver, तो जब वहाँ synthesis होती है वहीं deposition भी हो जाती है. So liver is a very common organ where there is a deposition of amyloid material, and that is always secondary to chronic inflammation. Serum amyloid material is also deposited in the renal tissues. The renal tissues में deposit हो जाता है तो renal failure है. So one cause of renal failure तो प्राइमरी एमाइलोइडोसिस था जिसमें इम्यूनोग्लोबुलिन, लेकिन हिस्टोलॉजिकली व्हेन यू सी इट अंडर द माइक्रोस्कोप तो आपका जो कैरेक्टर्स हैं एमाइलॉइड मटेरियल के वो वही होंगे जो प्राइमरी में है चाहे सेकेंडरी में। But renal failure could be because secondary to inflammatory process, or it could be secondary to plasma cell tumor or multiple myeloma. When it is secondary to multiple myeloma, renal failure के causes में primary amyloidosis भी आ जाता है और secondary amyloidosis भी आ जाता है. This is a patient on dialysis. यहाँ तक कि amyloid material is deposited in the glomeruli, leading to के patient के जो है ना यूरिया क्रिएटिनिन इतनी बढ़ गई कि उसे डायलिसिस पे जाना पड़ा. So the third type is transthyretin. Thyretin दो लफ्ज हैं, thyroid और retin is the eye. So normally ये प्रोटीन वो प्रोटीन है जो thyroxine binding और retinol binding प्रोटीन, that is normal protein. लेकिन ट्रांस मीन्स कि वहां की बजाय when it starts getting deposited and mutated, तो ये नेटिव प्रोटीन जो है वो इसकी मिसफोल्डिंग होने की वजह से और बाद में फाइबर्स बनने की वजह से, तो ये यूजुअली नर्वस सिस्टम में और प्लेक्स और न्यूरोफाइब्रल टिश्यूज में, these are the plaques, न्यूरॉन्स हैं ये, और इसमें न्यूरोफाइब्रली tangles और amyloid material gets deposited. तो जब वो डिपॉजिट करता है तो न्यूरॉन ट्रांसमिशन आपकी सफर करते हैं जिससे लॉस ऑफ मेमोरी होती है, और ब्रेन में भी जब डिपॉजिट कर जाता है तो यू कॉल इट Alzheimer's disease. I'm not going into the detail of Alzheimer's disease, but the last one is, you can say these are the four different types. This was the primary, which is related to bone marrow, and light chains are produced by the plasma cells. These are the organs involved, and this is SAA amyloidosis or secondary amyloidosis. That is secondary to chronic inflammatory processes, and usually the proteins are inflammatory proteins and they are deposited in the joints, the liver and the kidney. TTR is the transthyretin protein. तो ये नॉर्मल थायरोक्सिन और के साथ बाइंड करती है और रेटिनॉल के साथ बाइंड करती है, लेकिन वहां की बजाय जब ये नर्वस सिस्टम और हार्ट में चली जाती है तो इट्स कॉल्ड टीटीआर एमाइलोइडोसिस, एंड देयर इज अ म्यूटेंट थायर. दैट इज द रीजन द वर्ड म्यूटेंट इज रिटन. इट इज ट्रांसथायरेटिन, लेकिन नॉर्मल जगह पे नहीं है, म्यूटेंट है. म्यूटेशन की वजह से और जगह पे डिपॉजिट हो जाती है और इट इज यूजुअली अनस्टेबल, एंड दीज आर द ऑर्गन्स वेयर दे आर डिपॉजिटेड. एक आखिरी है दैट इज कॉल्ड सीनाइल SSA. दिस वाज SAA. This is serum associated. This was SAA. This is SSA. Senile systemic amyloidosis, which is usually seen with age process. तो आमतौर पे हार्ट में ये देखी जाती है, बट एरिथमियाज आर देयर एंड कार्डिक फेलियर, कार्डिक अरेस्ट वगैरह पेशेंट में हो जाता है. तो इसे सेनाइल सिस्टेमिक एमाइलोइडोसिस दैट इज एज रिलेटेड, दैट इज द फोर्थ टाइप. So I told you that there are 20 types of proteins which can get deposited, but these four are very, very common. So thank you very much. With that, we are done with this immunology and amyloidosis. I said immunology or immune system and amyloidosis. Amyloidosis is not immune system. Thank you very much, and best of luck. सवाल करते हैं तो बाद में कर लेना जब आप